Hearing changes after a concussion. Changes in hearing after a concussion are more common than most people realize. Patients may report ringing in the ears, sensitivity to sound, or difficulty processing conversations, especially in noisy environments. This isn't just an ear issue, it's often related to how the brain processes auditory information after an injury. In more advanced cases, imaging like diffusion tensor imaging or DTI can show changes in white matter pathways that are involved in sensory processing. When those pathways are affected, it can alter how sound is interpreted, not just how it's heard. If these symptoms aren't specifically addressed, they're often overlooked, even though they can significantly affect daily function.